Hi students, this is Dr. Tatum again. I believe that we left off with integumentary system as we were talking about our antepartum case study. So changes of the integumentary system are all related to the effects of hormones, so estrogen and progesterone, and then also the melanocyte stimulating hormone that causes increased pigmentation of our skin. All of these hormones affect changes related to our integumentary system. So one of the very first things I want to point out is that some women will experience darkening of the moles, freckles, their nipples, and the areola of their skin. Some women will complain of a line that extends from, it's a dark line that extends from their xiphoid process all the way down to their mons pubis, as you can see here in this picture. And this is called the linea nigra. And so this line becomes darker as pregnancy progresses, and then it will gradually disappear after pregnancy. Some women that have darker skin tones are probably going to see this more. Another thing that some women will experience is called chlasma. And so chlasma is known as the mask of pregnancy. And what you're going to see is darkening underneath the eyes, kind of around the brow area and the nose, as you can see here in this picture. It almost looks like raccoon eyes. This will gradually fade after pregnancy, but it can reoccur after exposure to the sun. And so some women might see this again even after she delivers her baby. But you can see during pregnancy what it looks like, and then after pregnancy what it looks like. But it's just that blotchy, dark pigmentation that occurs kind of around her eyes and her brow and her nasal area. Some women will also experience increased growth in their hair and also their nails. So their hair is going to look so full and shiny and vibrant during pregnancy, which is kind of exciting. Some women have never experienced a full head of hair before. But then the big thing to educate them on is that after delivery, she will start to lose that hair. So she starts to shed a lot, and it can be very alarming for some women. But reassure her that about 6 to 12 months after she has her baby, her hair growth is going to go back to normal, what it was before prior to pregnancy. Some women will also experience stretch marks, and so we call those striae. So here's a good example of what that striae look like. So this is found on the abdomen. Striae can also be found on the breasts, like we talked about, on the buttocks, around the thighs. So really lots of different places you're going to see stretching of the skin. The major place that occurs is the abdomen, just because the uterus grows and because the abdominal cavity starts to stretch more. And so these striae look pink to reddish in color. They will gradually fade to more of a silvery color, but they will never go away, which is really unfortunate. And nothing on the market has been proven to stop striae from occurring. So I just want you to know that there's no lotions on the market that she can start to use throughout pregnancy that will stop striae from occurring. Some people will use cocoa butter and put cocoa butter throughout their skin throughout pregnancy, and I don't know if it necessarily works or not. I think a lot has to do with genetics as well. All right, another noticeable skin change might be angiomas. If I scroll down, you're going to see a picture of an angioma, and this is more of a vascular spider. And so these disappear after delivery, but these are due to increased levels of estrogen in the body. They're tiny blue veins. So because there's increased blood flow throughout the tissues of the body, this is going to look more violet in nature, probably not so pinkish. But they appear on the neck, the thorax, the face, and the arms of the woman. And then another thing that she might complain of is a red palm, so palmar erythema, and that's due to the effects of pregnancy hormones. Those will gradually fade too. And then last but not least, she might complain of thickening of the gums, and we call that gum hypertrophy. So her gums become thicker. Some women might also complain of a raised nodule around the gum tissue that can bleed, and we call that a gingival granuloma. Some women will experience these things, others will not, but again, all due to the effects of pregnancy hormones. All right, let's move on, and we're going to talk about the neurological system. So, one of the main things that most women experience is a phenomenon called pregnancy brain. And I'm here to tell you that pregnancy brain is real. Unfortunately, I experienced it with all three of my pregnancies. But basically, it's characterized by just a mental fogginess. You have a hard time remembering things. It's characterized by a poor attention span, memory lapses. You're just forgetful. You can't remember anything. And some people will say, oh, well, that just happens with age. But really, it does occur with pregnancy. I have so many good stories to tell you, but I'm going to save myself from embarrassment. If you really want some specifics, please just ask me. But pregnancy brain is real. Also, there's a disruption in just sleeping. And so women that are moving into their second and third trimesters, they become more uncomfortable. They don't sleep as well. And a lot of times that can interfere with just our cognitive functioning. If we're not sleeping great, then that's going to make us a little bit more foggy in general. So really, we recommend good afternoon naps for her. If she can take a nap during the afternoon, that's what we want her to do. All right, moving on. One thing that I'd like to point out to you, and there's a picture here, is carpal tunnel syndrome. So some women, as they progress into their third trimester, they start to retain a lot more fluid. And sometimes this fluid can be so severe that it can compress the median nerve in the wrist. And a lot of times that causes pain, lots of pain that radiates through the elbow. She might complain of numbness and tingling in her hands at night. And she might also complain of more of a burning sensation as well. So it can be very uncomfortable. What we tell her to do is we tell her to elevate her hands at night if possible. So pillows might be a good option for her. Sometimes there's a splint that we tell her to put on her wrist. So it's kind of a hand wrist splint, and that can help her from avoiding flexing her wrist. That puts more pressure on that median nerve. I had this with one of my pregnancies, and I just wore my splint at night, and it seemed to help a little bit. So I wasn't flexing my wrist as much, and I wasn't experiencing that sharp pain and burning sensation. When people have this, it's really hard for them to pick up items and really just fully contract their muscles of their hand and their wrist area. So just be aware of that. If it does become severe, sometimes surgery will help relieve that pressure on that median nerve. So that is what carpal tunnel syndrome is. It does usually go away after delivery just because she starts to diurese a lot of fluid. And she will diurese a lot of that fluid that has been putting pressure on that median nerve. Other neurological problems would be syncope. So syncope is more of that fainting, dizziness sensation. And a lot of times it's caused by orthostatic hypotension. So again, if she's lying flat on her back, we worry about the weight of the uterus compressing the vena cava. So we don't ever have her lay flat on her back. Also, anytime she is straining to have a bowel movement, and sometimes constipation does occur with pregnancy just because the effects of that progesterone. Everything is slowed down, peristalsis is slowed down a little bit. So if she's straining to have a bowel movement, if she's coughing, sometimes those things can innervate that vagus nerve. And remember, the vagus nerve, once that vagus nerve is innervated, it causes a drop in blood pressure. So that's something else that contributes to that syncope that we're talking about. So just have her be aware of some of the warning signs. She might feel dizzy, faint, lightheaded. She might start to sweat. She might feel a little nauseated. So just educate her on some of the signs and symptoms that surround syncope. Some women may also experience tension headaches with pregnancy. And then other women might experience more muscular neuromuscular problems like muscle cramps in their lower extremities. And we'll talk a little bit more about this when we get to musculoskeletal problems. But Charlie horses are a great example of some of those neuromuscular problems. So calcium levels drop just a little bit, and sometimes that can cause really just bad Charlie horses in the calf region. And a lot of times that will wake her up at night. She'll complain of sharp, crampy pain in her calf region. All right, we will keep moving on. Let's move down to cardiovascular. So cardiovascular changes that take place. So really the anatomical position of the heart changes in pregnant women. The heart becomes pushed up and to the left as that uterus enlarges. You might see an enlargement of the heart, so hypertrophy. And so the muscle size of the heart increases due to increased blood volume. Cardiac output increases as well. Some patients might complain of systolic murmurs. So the first and third heart sounds are exaggerated and they're often heard during systole. So these are usually asymptomatic and they don't require treatment, but usually it's due to the increased blood flow. A lot of times patients that do have chest pain or heart palpitations or shortness of breath are told to contact their provider immediately. A lot of times these systolic murmurs will resolve after pregnancy once that plasma volume starts to lower. And so tell her just to watch for any odd signs and symptoms like heart palpitations, chest pain. If she is having those issues, she needs to contact her provider right away. Between 14 and 20 weeks gestation, the pulse rate increases approximately 10 to 15 beats per minute, and that will persist until the end of pregnancy. So pulse rate increases, and that is fairly normal. Blood volume and cardiac output increase to about 40 to 45%. And if we think about that in terms of milliliters, that's about 1,500 milliliters of blood. So that's a lot of blood volume. And this is usually plasma and also red blood cells. And it's just important because we need more red blood cells to carry oxygen to the baby. And so that's why you're going to see a large increase in cardiac output. The cardiac output is mainly directed towards the uterus and the placenta, just because, again, that placenta is the lifeline for the baby. Baby needs more oxygen and more blood. And so that's why you see that. Maternal kidney blood flow is also increased to excrete more urine. And then all this extra blood volume that mom has on board is usually excreted after delivery. So remember the first couple of days after delivery and that postpartum period, mom will start to diurese a lot of fluid. So she is peeing a lot, she is sweating a lot, and that's how she gets rid of all that blood volume. Also, circulation time decreases slightly by week 32. And so clotting factors are increased as well as fibrinogen. And she is at higher risk for blood clots, which we've already talked about. So if she is sitting for long periods of time, she needs to be told to get up and move. If she is going for a longer car ride, so if it's a couple-hour car ride, she needs to get out of the car every 45 minutes to an hour and just walk. Her hemoglobin and hematocrit are decreased due to increased plasma levels. So because we have so much fluid on board, hemodilution occurs. And so hemoglobin and hematocrit are decreased because of the increased plasma volume. And then we also, because of that, we worry about anemia. And that's something that the provider will be checking on quite frequently throughout pregnancy. And then last but not least, mom will experience different varicosities. So varicose veins and hemorrhoids. Those are always issues, especially as she gets into that third trimester of pregnancy. She might experience more hemorrhoids in her rectum, and that can be very uncomfortable for her. All right, so this concludes this second recording. I know I'm short on time, and so I'll pick back up and we'll start with changes in the respiratory system. All right, thank you.